Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everyone. Thank you so much for joining The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon in Atlanta, Georgia. I'm also the founder of Onika Bariatrics and Wellness. You can learn more about me and get connected at www.drshanibelgrave.com. I am super excited to welcome a very special guest to the show right on time for Fibroid Awareness Month. Dr. Sherley Samuels, an esteemed board-certified OBGYN, joins the show to share her expertise. Dr. Sherley Samuels, welcome to the Coalition. Thank you so much for being here.
Absolutely, my pleasure. Thank you for having me.
So I am so grateful that you were here on time to talk about fibroids. Fibroids are very common, and it is Fibroid Awareness Month. So can you please get us started by telling us a little bit about who you are and what you do?
Okay. Well, like you said, I'm Dr. Sherley Samuels. I'm a board-certified OBGYN. I've been practicing for about 15 years. That's including 4 years of residency and 11 years in private practice. And I am especially interested in minimally invasive treatment for issues that affect women and women's health. I'm also very passionate about addressing the Black maternal health crisis in the United States, as well as health disparities in women's health. As such, I am the founder of the Women's Health Leadership Initiative, which is a program aimed at helping prep the future generation of physicians to address women's health disparities. So thank you so much for having me. I'm super excited to be on your platform with you today.
Thank you so much, Dr. Sherley Samuels. I am grateful for the work that you are doing, very exciting work that you are doing with your organization.
Thank you.
So thank you. So let's get into it. Now, can you please let people know, first of all, what are fibroids and kind of how common are they?
Yeah. So fibroids are benign tumors that grow in the uterus. They can grow in any layer or any part of the uterus. They can also hang off of the uterus. I kind of explain that to my patients like dangly earrings almost. So they can dangle from the uterus or be within the tissue. And they are extremely common. By age 50, 70 to 80% of women will have been diagnosed with fibroids. And that might be an undershot as far as the number, because a lot of times they are asymptomatic. So some women don't know that they have them, but extremely common, but benign tumors. And so you don't necessarily have to bother them unless they're bothering you.
And boy, can they bother you. So, yes. So the next thing I wanted to ask you was, how can someone know? Because if they're asymptomatic and they're benign, no problem. But how does someone know whether they're having menstrual issues or horrible periods, whether or not it could be fibroids that are the culprit?
So first of all, the main thing is that every woman experiences menstruation differently. And so knowing what's normal can be a little bit tricky. Certainly, if you have very minimal pain, very minimal bleeding, or light bleeding, that can be considered normal. But there are variations to what different women experience. And so the main thing for me that I think should prompt an evaluation to assess what's going on, maybe you have fibroids, maybe you have something else going on, is if your symptoms are affecting your daily life. So if you're having bleeding to where you're saturating pads, you're soaking your clothes, you're having to pack extra clothes, you're having debilitating pain, you have to take off of work, you have to miss school, you're having difficulty caring for your family or caring for your loved ones, those are all reasons to prompt you to evaluate and make sure that there's not something else going on. Because severe debilitating symptoms that are impacting your life would not be considered normal.
So you mentioned that some of the symptoms could potentially be heavy bleeding. Are there other symptoms that could be related to to the fibroids as well
To
that
fibroids,
maybe aren't
yeah.
talked about as commonly?
So certainly heavy bleeding, particularly passing clots or soaking through pads, like I mentioned. But other things outside of the menstrual cycle could be pelvic pain, pelvic pressure, pressure sensation, difficulty with urinating or frequency of urination, constipation, pain with intercourse, and infertility. Those could all be due to the presence of fibroids.
Great information. Thank you so much. So, Dr. Samuels, what are some of the treatment options for fibroids?
Okay, so there are numerous treatment options, and this is a super important question because studies have shown that different demographics are offered different treatment options, and so it's important for women to know what their options are when they go in to get counseling and get evaluation. Particularly for Black women and women of color, hysterectomy has been shown to be the first-line treatment offered, but there are many other options to be considered. So for instance, conservative management, first and foremost. Remember, we said at the beginning, if it's not bothering you, you don't necessarily have to bother it. If it's not debilitating, if it's not something that's affecting your life in an extreme way and you don't feel like you need treatment, you don't necessarily have to have treatment. So conservative management is one. We also have medical options, so hormonal and non-hormonal. For people who are interested and able to take hormones, we have birth control methods and other hormonal options that we can use. But some women don't want to take hormones. Some women can't take hormones because of other things they have going on. And so we have non-hormonal medications that we can use as well. Something, for instance, like tranexamic acid, which is a medication that kind of helps to slow down the blood flow each cycle without necessarily being a hormonal treatment. Then we have surgical options, and we can kind of branch those off into minimally invasive and then more invasive options. So some minimally invasive options would be things like a hysteroscopic myomectomy, which is a myomectomy or removal of the fibroid if it's inside of the uterine cavity. That doesn't require any incisions on the abdomen, so that would be considered minimally invasive. We also have procedures such as the uterine fibroid embolization. That's a procedure by which we cut off the blood supply to the fibroid. So if there's no blood supply going to the fibroid, it's not going to be able to grow very much, and it may even shrink. We have a uterine fibroid uterine fibroid ablation, which is where we basically use technology similar to microwave technology, insert a device into the fibroid and kind of blast it from the inside out. That's pretty cool. Another minimally invasive option that we can do. And then we have our more invasive options, which would be myomectomy, where we need to make incisions on the abdomen. And we have hysterectomy for those who desire definitive treatment in that way. So there are many different treatment options. And I think it's important to just impress that neither hormonal birth control or hormonal options or hysterectomy are the only option.
So many different options for the treatment of fibroids. Not everyone has to necessarily jump right to hysterectomy, depending on patient preference and the other variables. But you raised a lot of good points. I had a few follow-up questions. The TXA, tranexamic acid.
Yep.
Are there any concerns there in terms of side effects from taking that medication? Because I've heard some patients voice to me concern of having increased risk of clots.
Yeah, absolutely. So tranexamic acid is essentially an antifibrinolytic. So it stops the process by which we break down our own clots so that it allows the clots to kind of hang around a little bit more. And that helps to kind of stop the or temper the menstrual flow. Certainly this medication and any of the options that we discuss, you're going to have to tailor it individually to the patient, because not every patient is going to be a candidate for hormonal Contraception, not every person is going to be a candidate for hysterectomy. Not every patient is going to be a candidate for TXA. Certainly, if you have an increased risk factor for clotting, that would be something we would take into consideration and maybe look at other options for that patient.
Thank you. You mentioned hormonal, there's certain patients that can't do hormonal therapy. Who are some of those patients based on what history?
Yeah, so some of those patients would be someone who's had an adverse event from hormones in the past. So if you took birth control in the past and developed a blood clot, let's say, then we would not want to put you back on those medications. Also, someone who may have a personal history of breast cancer or certain types of breast cancer, particularly those that are estrogen and progesterone receptor positive, we'd be cautious. Someone who has significant cardiovascular disease history, like history of stroke, heart attack, particularly if they're smokers, because that risk is greatly increased. So again, it's all about individualizing the care for the patient and making sure that the treatment that a specific patient opts for is the safest option for them.
Yeah, I think what you said is so important, that it has to be individualized, because some of it also depends on, as you alluded to earlier, the location of the fibroid.
Correct.
Because certain options, depending on where your fibroid is located, may not be a viable option. So.
Absolutely. So, I mean, some certain things that we look at to determine what could even be your personal option, right? Because we're talking about all the different options under the sun, but for a specific patient, where are the fibroids located? What are the size? What are your desires for future fertility? What are your medical comorbidities or your medical history? All of those things would, help us determine what's the best treatment for a specific patient.
Perfect. Thank you so much for this really good information that I know is going to help a lot of people. The other thing I was going to ask you is, are there any recommendations for dietary things that can reduce the risk of the fibroids getting bigger or being asymptomatic?
Yeah, and I get a lot of questions about this from my patients, so that's a really good question. So there are some anecdotal, studies and information out there that point to cutting out meat and dairy. And the theory behind that is essentially that those things, since they come from a mammal or an animal, they can potentially have hormone in them, or those animals may have been treated with hormone for different reasons before they were slaughtered. And so the presence of those hormones can potentially stimulate the growth of the fibroids. I will say, though, we have to kind of be cautious with that because there isn't a whole ton of evidence to support that. I have plenty patients that are completely vegan and have been for years and years and years and have fibroids. And so while the theory is there and you can make sense of it, I think that the presence of fibroids are going to be multifactorial. They're going to be due to genetic factors, environmental factors, maybe even social stressors. We just don't have enough evidence to support one way or the other, cut out meat all the way and cut out dairy all the way or not. But that is the only thing that I've seen. I have had some patients talk about different herbs, different maybe herbal teas and things that they would like to try before treatment to see if they work. And as long as it's not going to hurt the patient, I'm always like, hey, go for it. But same kind of thing, I explained to them, there isn't much evidence to support. By evidence, I mean studies, powered and randomized controlled trials and things of that nature to support any herbs specifically reducing the size of fibroids.
Thank you so much. I'm so happy to have an expert on the show because, I've heard patients say so many things, from eating for your blood type, all kinds of different things that people are trying to see if it's going to work. And I'm like, well, I haven't seen any data But if something's not harmful and you want to try it, by all means, that's
how,
fine.
and I feel like sometimes you have to meet patients where they are on this topic, because it's a very sensitive topic. And it's a topic that I think that for a very long time, women feel dismissed about and not heard. And so that has led them to try to venture out and find other things, because, if their mom and their aunt and their grandma were all told hysterectomy and that's it, and that's not what they want, then they may have it in their mind that that's going to be the only thing that they're offered. So I like to just kind of lay out all the different options, allow them to kind of navigate this space and some holistic things if they want to try that, as long as it's not anything that's going to be harmful to them, of course, and then circle back if and when they're ready for me to intervene.
Well, thank you so much, Dr. Samuels. I think that that's an amazing takeaway, is for people to have some information so that when you're going into your appointment, you're not only heard of hysterectomy, but you're like, hey, maybe I can ask about uterine fibroid embolization, or if myomectomy might work, or if hysteroscopy might work. So I think that that's great information to put out there. So for women who are interested in pregnancy that have fibroids, how is that navigated? Because you mentioned the fibroids can be a cause of infertility.
They can, but I want to start off by saying that many women with fibroids go on to have healthy, beautiful, full-term babies and have no problem whatsoever. And so I definitely want to start off with that piece, because I don't want it to get, lost in translation. Oh my gosh, I have a fibroid, that means this. Absolutely not. Many women, it's completely, it doesn't affect the pregnancy at all. But in the instances that it does, they can cause infertility, so difficulty with getting pregnant, particularly if they're located within the endometrial cavity where a fetus would need to implant and grow. They can, in the same sense, cause preterm delivery, preterm labor, and even pregnancy loss before a baby is able to survive outside of the womb. And that's for the same kind of reason. If they're taking up space in that cavity, then there's less space for the infant or the fetus to grow. So that can lead to preterm delivery or even pregnancy loss. Fibroids can also kind of cause some postpartum issues. So after you have the baby, you are at a higher chance of having heavy bleeding, because that fibroid tissue just doesn't contract down like normal uterine tissue. It's just kind of there. And that can lead to heavy bleeding, which can then lead to, other interventions such as medications, blood transfusion, even surgery. But again, that's not really the rule. That's more like the exception. So how do you navigate a pregnancy with the presence of the fibroids? Basically, early prenatal care, disclosing that early if you know you have a history. And if you're unaware, 9 times out of 10, they'll be diagnosed during one of the many ultrasounds you're going to have during pregnancy. And if we find a fibroid or fibroids, we'll be monitoring your pregnancy a little bit closer, maybe a few extra ultrasounds to watch the growth, and just preparing for hemorrhage, at delivery. Not that we're claiming it's going to happen, but we always want to get ready and stay ready. So, just kind of having all the things that we potentially need for a hemorrhage present at the bedside.
I love that, Dr. Samuel. Stay ready so you don't have to get ready. Another takeaway.
Yes, well, that's what I was trying to say. Stay ready so you don't have to get ready. Exactly.
Well, thank you so much, Dr. Samuels, for joining the coalition right on time for Fibroid Awareness Month. What is the best way for people to get connected with you?
So I am on Instagram, mainly on my initiative page, so at official.whli. You can also check out my my practice website where my full bio is listed, as well as how to get an appointment with me if you're interested. That's at www.covingtonwomenshealth.com. Those are the main ways I answer DMs, I answer messages, and my practice is accepting patients.
Beautiful. Well, thank you so much, Dr. Samuels. I hope to see you back on the show another time.
Absolutely. It's my pleasure. Thank you so much for having me.
Thank you. Well, everybody, thank you so much for tuning in to another impactful episode of the Coalition Talk Show. I'm your host, Dr. Shani Belgrave, bariatric and minimally invasive surgeon in Atlanta, Georgia. I'm also the founder of Onika Bariatrics and Wellness. You can learn more about me and get connected at www.drshanibelgrave.com. Very special thank you to the esteemed Dr. Sherley Samuels, OBGYN, who shared her expertise on fibroids right on time for Fibroid Awareness Month. You can get connected with Dr. Samuels on her Instagram or at her practice website. Make sure you share this episode with friends and family to raise awareness on fibroids. I'll see y'all next time.